10 signs of cervical cancer you need to know early. Cervical cancer has been and is a leading threat to the health and life of women globally. According to statistics of the World Health Organization, WHO, each year the world records more than 500,000 new cases and has about 250,000 deaths. It is estimated that by 2030, the number of deaths from this disease could increase to 443,000, double the deaths related to obstetric complications. Cervical cancer is the third leading cause of cancer death in women, after breast and ovarian cancer. All women are at risk for cervical cancer when they start having sex. What are the early signs of cervical cancer? In the early stages, the signs of cervical cancer are quite faint because the disease develops silently. The symptoms are not clear. When the patient feels abnormalities, it is also when the cancer has begun to metastasize. At that time, it is still possible to intervene with different treatment methods, but the success rate is not high, consuming a lot of time, effort and money of the patient. What is cervical cancer? Cervical cancer is a disease that develops due to the abnormal, uncontrolled growth of cells in the cervix. These cells grow rapidly and create tumors in the cervix. About 99.7% of cervical cancer cases have the presence of HPV virus, the causative agent of sexually transmitted diseases. Cervical cancer is a disease that progresses slowly over a long period of time. Signs of cervical cancer are easy to confuse with other gynecological diseases. In the precancerous stage, the disease has no symptoms, so it is difficult to detect abnormal cells forming in the body, if the patient does not go to the gynecological examination and have regular screening tests. Here are 10 signs of cervical cancer. Number 1. Abnormal vaginal bleeding. This is the most characteristic symptom of cervical cancer in the early stages. It is caused by changes in the lining of the cervix. The cancer grows in size, invades nearby tissues, creates new, fragile blood vessels, causing bleeding. Abnormal vaginal bleeding occurs between menstrual periods, after sex, after menopause, after going to the toilet. The degree of bleeding is different for each person. The blood is usually bright red, the amount is small, a lot, stops on its own but then repeats and gradually increases in frequency. Number 2. Abnormal vaginal discharge. Vaginal discharge is less at first, then gradually increases, may be thin or mucoid, milky or green like pus, or mixed with blood, with an unpleasant odor for a long time. Number 3. Pain or bleeding after sex. Pain during sex is an important warning sign of genital tract lesions, including cervical cancer. There are many causes of pain during sex. If you encounter this condition, you should go for an early checkup for appropriate treatment or early diagnosis of cervical cancer in the early stages. Number 4. Pelvic pain, lower back pain. If you have a lot of pain in the lower back, pelvis, it is a warning symptom of changes in the cervix. The formation and growth of tumors in the cervix cause many obstacles to the oxygen supply of cells. So when there is a dull, sometimes intense pain in the pelvic region, it is necessary to pay attention to the examination. Number 5. Discomfort while urinating. Discomfort and stinging when urinating can also be a warning sign of cervical cancer. Urinating more often, incontinence, urine color, abnormal smell, especially blood in the urine. Usually, urinary tract symptoms occur when the cancer has spread to nearby tissues. Number 6. Urinary incontinence. Uterine tumor or tumor compression can significantly affect the function of intestinal circulation and urinary tract, thereby changing the patient's bowel and urination habits. Patients may have bowel disorders such as diarrhea, constipation, diarrhea alternating with constipation or urinary incontinence. Number 7. Menstrual disorders. Cervical cancer can also cause hormone imbalances in the body, affecting development and ovulation. This leads to menstrual bleeding that lasts longer than usual, menorrhagia, and dark black periods. Number 8, tired often. Most cancers cause weight loss, loss of appetite, and weight loss. Cervical tumor compresses the stomach, making the patient not want to eat. Cancer also reduces the number of healthy red blood cells and is replaced by white blood cells to try to fight the disease. This leads to anemia, weakened immunity, fatigue, and lack of energy. Number 9, losing weight for no apparent reason. Weight loss is one of the early signs of cervical cancer that patients can experience early. The cause may be related to abnormalities in the digestive tract, or systemic disorders caused by cancer. If you have sudden weight loss in a short time, you should take the initiative to visit the hospital to check your health status. Number 10, painful swelling in legs. As the tumor grows and spreads, it will compress nerves and block blood from reaching the extremities, causing swelling and pain in the legs. The pain tends to be continuous and worsen over time. The 10 warning signs of cervical cancer above can warn you that you are suffering from this disease in the late stages. Therefore, do not wait until you have symptoms to see a gynecologist. Immediately visit a specialist facility for examination and timely treatment when there are unusual symptoms. Vaccination against HPV virus is considered the simplest but most effective preventive measure to reduce the risk of disease in women. The HPV vaccine, which is widely available worldwide, has the ability to prevent damage and infection caused by 2 high-risk HPV types, 16 and 18. In addition, the vaccine also helps prevent genital warts and other cancers of the genital organs such as vagina, penis, vulva, anus,